The FDA has just announced approval for a new pain medication. This is suzetrigine, which is trade name JOURNAVX. And because this is a new drug with a unique mechanism of action, I've received a few questions about whether it could help with chronic pain conditions such as fibromyalgia. And so I thought it would be a good idea to do a short video and explain why this drug is not likely to be helpful for things like fibromyalgia, in my opinion. So let's talk about that. So if you follow my channel, you know I'm Dr. Jared Younger. I'm director of the Neuroinflammation, Pain, and Fatigue Laboratory, and I keep a very close eye on new chronic pain treatments, especially those that provide alternatives to opioid medications. So when I saw this one come out just a couple weeks ago, I was excited because it works in a way that I've been waiting for decades. So the quick story is way back in my undergrad days, we learned about a rare condition called congenital insensitivity to pain with anhidrosis. And these are babies that are born with an inability to feel pain. So as you can guess, if a baby can't feel pain, that would be devastating because pain is absolutely necessary for avoiding injuries. So that is a horrible condition, but I and pretty much every pain researcher ever anywhere in the world has wondered, well, okay, how can we induce this insensitivity to pain in people who need pathological pain shut off? How can we use this condition? And it was discovered quite a while ago that the condition is caused by a genetic mutation that causes the pain detecting fibers to have non-functioning sodium channels. And the sodium channels are essential for the action potentials that allow the pain neurons to communicate and send those pain messages to the brain for processing. And so blocking sodium channels is one way to stop pain transmission, and therefore it stops pain. Now, the medical field has used sodium channel blockers for decades to stop pain. So anytime you get a lidocaine injection, like a little kind of dermal lidocaine injection for like a small dermatologic condition or maybe some tooth work, maybe, it's very effective. So one injection in the right place can completely shut off pain in that region. And it does that by blocking sodium channels. Now that's great. It works really well, but that's for a very small area of pain, small pain in a very specific area. It's a local injection. So the question is why can't we just give lidocaine by mouth and stop pain all over the body, such as with fibromyalgia? And there's a few reasons why we can't do that, but one critical reason is that sodium channels are used by almost every neuron type, not just pain neurons. And so if you blocked the sodium channels, it would cause all kinds of unintended consequences. It would cause your heart to develop arrhythmias, your muscles wouldn't fire correctly, you would get seizures, it would be very dangerous. So how is this new drug different? What this company did with suzetrigine was to produce a drug that blocks sodium channels, but only on the pain neurons. So the blockade is specific to pain. So now it can be given systemically, such as by mouth, without worrying about the effects on other neuron types. So the FDA approval is for moderate to severe acute pain. So it can work throughout the body to reduce pain from things like the main things being injuries, like really bad injuries or big surgeries. So you can give this instead of an opioid to stop pain. And now you don't have a concern of opioid addiction because suzetrigine does not reach the brain to cause euphoria like an opioid would. So it's in no way like an opioid painkiller. It blocks pain like opioids, but it doesn't have the addiction potential. So far, that's great. So why do I say it's unlikely to help things like fibromyalgia? Okay, so there's generally two types of pain neurons. It gets a little more complicated, but we're going to say there's two main types of pain neurons. There's A delta neurons, which transmit really fast, sharp type pain. And then there's C fibers, which communicate slow, dull, throbbing, aching type pain. Now, we generally associate fibromyalgia with C fiber problems because it involves this deep aching pain. The problem is that suzetrigine seems to mainly block sodium channels on A delta pain neurons, not the C fibers. So that's great for acute pain from injuries, but it probably has limited utility in chronic pain conditions such as fibromyalgia. It's basically a different type of pain being carried by different neurons. And for that reason, I'm not really motivated to try this out in chronic pain patients, especially fibromyalgia. Another reason it's not very high on my list is because we don't have good data on long-term use of the drug, because it's really designed right now and approved for acute pain. It's only meant to be used for days or maybe a couple of weeks. So I don't know how safe it will be to take this daily for months or for years, like you might need to do with chronic pain. Now, it's possible a drug like this could help fibromyalgia. So I don't want to say it's impossible. There are models of fibromyalgia where A delta fibers are transmitting pain messages to the brain and they're being misinterpreted. So A delta could be involved, but it's just my guess, my hypothesis, that suzetrigine would not work much better than placebo in fibromyalgia. Though again, I could be wrong. I do want to note that there are some pain conditions, some chronic pain conditions where I could see suzetrigine being helpful potentially, although to my knowledge, none of them have been tested. Things like small fiber neuropathy, complex regional pain syndrome is a good one. There's some types of neuropathic pain that could be helped, some types of trigeminal neuralgia, maybe post-herpetic neuralgia, such as after a shingles outbreak that can cause chronic pain. So it's possible. I can see a use, but we have to run trials to know if it does. I could see it going either way. I do think right now it would be useful for groups to run really small trials on different pain conditions, maybe 10 people, just to see if there's something interesting there. That would be worth doing. But I want to make it clear, I don't recommend anyone go out and ask their physician for a suzetrigine prescription for their chronic pain. There's just no good reason to do that now. That's not a knock on this drug at all. This is a great, maybe even breakthrough advance for treating injury and surgical pain. I love seeing non-opioid directions being taken. Opioid addiction is devastating to individuals. It's devastating to families, to communities, and it can even be devastating to nations. And so it will be a very good day when we can completely abolish pain without getting people addicted to a substance. So I hope that's helpful. I'll be back soon. In the meantime, I'm going to be finishing up a grant resubmission for a clinical trial. So a resubmission means I'm now responding to the critiques from my first submission, and hopefully I can get the grant to a place where it's funded. So I will get that out in the next couple of weeks. And also I'm preparing several proposals for new treatment pilot studies. These are smaller group studies, and we'll talk about all those very soon, and I'll catch you up on what I'm working on now. So we'll talk soon, and bye.